my name is Caitlin Palachuk, and I'm with Cook County Health and Hospital Systems. Thanks for joining us. If you need help with an appointment or have a medical question, you can reach our health system at 312-864-0200. Today I have two very important guests on this show, Dr. Kirah Joshi and Gina Barnett with Cook County Department of Public Health. Welcome to the show.
Thanks so much, Caitlin.
Can you tell us a little bit more about each of your roles as well as what the health department does?
Sure. So I'm an attending physician with the Cook County Department of Public Health. I oversee a couple of areas in the department, including our chronic disease unit, as well as epidemiology, emergency preparedness, and communications. I'm also an attending physician with with John H. Stroger Hospital in the Department of Family Medicine.
Cool.
Great. Good afternoon. It's great to be here. I'm the Deputy Director of Public Health Programs. I support the executive team with the strategic plan and also our Community Health Assessment and Improvement Plan, known as WE Plan 2020. And lastly, oversee a few different units, to advance community health. And I also am supporting the Chief Operating Officer on the 2018 Food Summit, which we'll be talking about later in this segment.
Excellent. And can you tell me a little bit more about what the health department does?
Sure. So we are the state-certified local public health department for suburban Cook County, for most of suburban Cook County. We have a number of areas. And we're also, most importantly, we serve a large jurisdiction that's pretty complex. We've got over 125 municipalities, 700 square miles, a number of townships, a number of school districts, police and fire, and we're really proud to work with all of our partners to advance our work. We're also, of course, an affiliate of the Cook County Health and Hospital System. Some of the services and some of the work that we do includes chronic disease prevention and control, which Gina has a really large role in. We do community health assessment and planning for our jurisdiction for suburban Cook County. We also are responsible for emergency preparedness in suburban Cook County, public health emergency preparedness. And we have other units that also provide, for example, nursing home visits for children with developmental issues. We do restaurant inspections in certain select areas in suburban Cook County, including all of unincorporated suburban Cook County. And of course, if there are any outbreaks of communicable diseases, we would also investigate those and do our best to control them.
Nice, thank you. So September is Fruits and Veggies More Matters Month, and it's focused on helping Americans increase fruit and vegetable consumption to better their health. Can you tell us a little bit more about how fruits and vegetables, like how many fruits and vegetables people should eat per meal?
Yeah, so I think most Americans have a hard time getting fruits and vegetables into their diets. And I think that's very understandable because people have really busy lives. But I think what's really important to acknowledge is that not only are consuming more fruits and vegetables healthy for you and good for you, it could also be really delicious. So I think the recommendation is to fill half of your plate with fruits and vegetables.
And what fruits and vegetables are considered to be the most nutritious?
Sure. So I think the main thing there is just to make sure, again, that you're filling half of your plate with fruits and vegetables. And, I don't discriminate between canned food, frozen food, or fresh. Obviously, if you can get it fresh is best. But like I said, I know folks are busy, and it's hard to get those fruits and vegetables into their diets. I personally am a huge fan of things like beans and peas and nuts. You can whip up a really nice, delicious, quick and easy bowl of chili within 30 minutes. And that's one of my favorite meals, I'd say.
Something very popular right now is people eating more organic foods. Is it true that organic foods contain more nutrients?
Yeah. So I think there are certain cases where it may be advantageous to purchase organic foods, but one of the main things I'd say there is that all the evidence that I'm aware of shows that there's no difference health-wise between organic foods and any other kind of produce.
Is there a reason why they're more expensive?
I think there are more requirements put on the producers, and so I think that translates to more expense.
Okay. So When I was a little kid, I didn't like to eat my fruits and vegetables. What advice could you give the parents at home in order to encourage their children to do so?
Sure. I think first and foremost, you want to make it fun. And you want to kind of involve your kids and engage them as much as you can. So I would suggest starting with when you go shopping. They have those like little mini shopping carts, and my kids love driving those around the grocery store, and I think most kids would too.
Yeah.
I mean, I wish honestly that they had those around when I was a kid. So my daughter loves to pick out fresh fruits and vegetables in the produce aisle. One more quick tip is that you want to stay around the outside perimeter of the grocery store, because like usually the unhealthy stuff is more often at the center, right? And you'll find that the produce aisle is more often kind of on the outside. So once you've bought your groceries, including of course a lot of fresh fruits and vegetables, or canned or frozen if that's what you're into, you want to go home and again involve and engage your kids in the cooking process. And just starting with maybe a simple salad, I think is a good option. You can involve kids with helping you measure out ingredients. And when they get older, it can be fun for them to help with chopping. And that's one less thing that you have to do.
Thank you. So when you're at the grocery store, is there a way to tell if something is more fresh than another piece of fruit or vegetable? How do you tell? How do you determine the difference?
Sure. So with fresh fruits and vegetables, I think it's a little bit different for each one. And as my mom could attest, it's an art, and I would say probably more of an art than a science. And I think that just sort of comes with experience. With frozen stuff and with stuff in cans, you could look at the sell-by date to find out like what's been packaged most recently.
And then sometimes they say sell by date and then it's on sale. If you know that you're not going to be eating it on a Tuesday and that's when the sell by date is it okay to continue to eat it after the sell by date?
Yeah, I think generally it's okay. Like if it looks okay, I would say generally it should be okay.
Okay.
But you do always want to make sure that with fresh fruits and vegetables that you give them a nice wash before you consume them.
Right.
Even the stuff that's labeled as being pre-washed.
And how do you go about washing them?
I think having a colander and giving them a nice rinse is just a good way to do it.
Should you only buy fruits and vegetables in season?
I think some people are into that, and I personally am, only because it helps me switch things up a little bit. So I think it's more of a preference than anything else.
Is there a reason why some fruits and vegetables are more expensive out of season? Is it just based on availability?
I think it's based on availability and how far they have to ship them to get them to you.
Right. And what are the long-lasting health benefits from fruits and vegetables?
Yeah, so I think definitely there are, you'll see improvements just in terms of your energy levels and how you feel. I was just having a conversation with my dad, and he had made some changes in his diet, and he's a vegetarian, moving to consuming a little bit more fresh fruit and vegetables. And he had started to just like feel better within a couple of weeks. And I think most people should probably see that. I think eating more fruits and vegetables can also mean that you've got more fiber in your diet, which means you're going to be more regular, right? So I think that's a good thing too.
Yeah.
And there's also benefits for many chronic diseases, including heart disease, reducing stroke, and diabetes, and control of your blood sugars.
Speaking of being a vegetarian, can you talk a little bit about these diets that people are on? Like there's a keto diet, there's a Mediterranean diet, people still are on the Atkins diet. Are those worthwhile checking out, or do you not believe in that?
Again, I think it depends largely on the person. I think the main thing is that you want to find something that works for you and stick with it. From my understanding, there's been a lot of evidence, a lot of research specifically on the Mediterranean diet, which is a diet high in fruits, nuts, vegetables, right, olive oil, and there have been shown to be health benefits from that, specifically heart health. So.
And I know that the keto diet is based on consuming more fat to burn more fat. Do you know anything about the science behind that?
Again, I would say stick with something that works for you.
Okay, thanks. Well, the 2018 Food Summit is approaching next month with the Chicago Health and Hospital Systems, as well as the Cook County Department of Public Health and Loyola University Chicago. Can you tell us a little bit more about this event?
Yeah. Yes, I'd be happy to. And this is really a great collaboration between these three organizations. It's our third annual summit, and the theme this year is how to make good food affordable and widely available. So really looking at the local food system and some of the aspects outside of individual choice and what we can do, but really how the system produces and creates food. It's scheduled for Friday, October 5th and Saturday, October 6th at Loyola University Chicago in Maywood. And we really encourage anyone or any organization that is interested in local food system transformation to improve health, support sustainability, and ensure food justice. And what's really exciting about the upcoming 2018 Food Summit is that this event is really a launch to the recent adoption of the Good Food Purchasing Program by Cook County government that can really be a powerful catalyst for transforming our local food system and increasing access to healthy foods for all.
Is there a cost for this?
Yes, the cost is $50.
$50 per person. And then is there any type of discount for seniors or children that are accompanied with a parent?
Yeah, that's a great question. Right now, the cost is $50. Okay. If somebody is interested in attending but cannot afford the registration, there is information on where to call and email on our website.
Cool. And then what number can I call if I need more information?
Yes. So the number is 708-633-8350.
Thanks. And then you said the website is?
cookcountypublichealth.org.
And then is there a limited number of slots available? Are you expecting to sell out?
Yeah, so we're hoping to have 250 people. That includes the speakers and some of the CCDPH staff that are staffing the event. So we're really hoping to have a big crowd. We have an incredible agenda and lineup of speakers that really are gonna inspire participants with this new vision for food system transformation, share the investments and policy opportunities really to advance our local and regional food systems in an equitable, healthy, and sustainable way. And we're also going to engage participants in discussion around the Good Food Purchasing Program that really is going to allow them to have a voice around how we can make sure that we effectively implement it here in Cook County.
Great. And you mentioned equity. What does that mean in regards to food?
Yeah, so there's a few different ways that equity can play out. One is that there is injustices and inequities around who has access to good foods. Mm-hmm. So there's terminology such as food deserts or communities that have lack of access to grocery stores or other types of supermarkets. But it also can play out in really having, and this is the food justice side, is having communities exercise their right and abilities to grow, sell, and eat healthy foods. And again, making sure that they're affordable, nutritious, and really think about the well-being of the land, animals, and the workers that actually produce and make the food.
Thank you.
Yeah.
I believe that we have a caller. Hello, caller. Go ahead. Thank you.
Good evening, Dr. Joshi. How are you this evening?
Hello.
Nice to see you up there.
Thank you.
City of Chicago. Yes, we need all the good advice we could get.
Thanks so much.
I have a few questions for you. First of all, my husband's type 2 diabetes, and he also takes testosterone. He's like at a certain age, 57 years old, and I'm wondering does that have anything to contribute to his sugar fluctuating high, and or some days he's low or some days he's high. Does that have anything to do with it? I mean, because the doctor put him on the testosterones, but his sugar fluctuates. Sometimes it's 180, sometimes it'll go down to 110. You know, he tests himself a couple of times a day. Would that have anything to do with the fluctuation of his sugar? And also, does it also have stress got to do with making your diabetes go up and down like that, doctor?
Yeah, that's a great question. So if I heard correctly, the medicine that your husband is taking is terazosin.
Testosterones.
Say again?
The testosterones.
Testosterone. I'm sorry, I'm not familiar with that medication.
You know, testosterones for his libido, for his testosterones, for his menopause.
Okay. So, different medications can affect your blood sugar in different ways, and I would certainly encourage him to have a conversation with his doctor about the potential effects of his medication on his blood sugar. In terms of kind of the fluctuations that you described, I think it would also be important for him to maybe keep a really good record of that.
Oh, he does.
Then kind of and review that with his doctor at his next visit.
Oh, he does. He goes every single month to the doctor, and we just can't figure it out why it's going up and down. Right. Because like I said, he doesn't take the testosterones all the time. And I have one more question for myself, if you don't mind, doctor.
Of course.
I went to the doctor, and she said I'm on the borderline of a high thyroids. What is a thyroid, doctor? What is a thyroid?
A thyroid is an organ. It's located right here in your neck. And it has like a lot of different functions. And it depends on what your doctor means by borderline. Sometimes that has to be treated with medicine, and sometimes it doesn't.
Right. Well, they didn't put me on no medicine yet, so I must be okay then, huh?
I would hope, yeah.
And one last question. Here comes flu season. Any new kind of flu shots going out there, or just go get a plain old flu shot? What do you think?
Yeah, so there are several varieties of the flu vaccine that the Centers for Disease Control, the CDC, has approved. I think one of the most important things that you could do for your health is to get vaccinated, get vaccinated, get vaccinated.
Absolutely. Young kids, old people, all kinds. There's no excuse not to get I work in the food industry.
Wonderful.
That's the first thing I get is a vaccination shot. A lot of people are afraid to get it because they think they're going to get sick. That's all old wives' tale. You get sick if you don't take the shot. And you ladies look so pretty smiling on that TV. I swear to God.
Thank you.
Yes. Well, let me get off the phone. Dr. Rashu, you're the best. I belong to Gottlieb Hospital, Dr. Dubine, for 20 years. He's a great doctor. And thank you for all your answering my questions.
Thank
Good
you.
night
Thank
for
you
calling in, ma'am.
Yeah, thank you for being a champion for public health.
Okay. Well, I'm glad that we have a lot of people that are watching the show today. So another thing that's going on is the health system is partnering with the Greater Chicago Food Depository in an effort to address issues of food insecurity. Can you tell us about these efforts?
Yeah. So as I mentioned, the Cook County Department of Public Health is an affiliate of the Cook County Health and Hospital System, and I sort of have my feet in both worlds here. And so the work that the clinical side of the system has been doing here, I think I'm really proud of and proud to talk about. So I think so first of all, I just want to say that food insecurity or this problem of people really not knowing where their next meal is going to come from is a major issue in Cook County in general. And to the point that like 1 out of 6 people are food insecure. And again, so that means 1 out of 6 people in Cook County does not know where their next meal is going to come from. So as you can imagine, this could have major effects on folks' health. And I think, again, I'm really proud to say that our health system recognizes that and has been doing a lot of great work to try to address it. So first and foremost, we have to be able to identify these folks, right? And so we've put into place a screening where we try to get at who is food insecure. And once we have a sense of who those folks are, we can try to connect them with services. And not only that, we try to provide them with food. So all of our clinics have food trucks that come to the clinic and provide fresh, healthy food to patients that are food insecure. So patients are given like a voucher, and they can exchange that voucher for 20 to 25 pounds of fresh food on sort of designated days.
Is it $20 worth of fresh food or pounds?
I believe it's 20 to 25 pounds.
Cool. And so if I were to go on one day and I didn't want to purchase all 20 pounds, can I come another day and use the rest of the voucher?
Yes, I believe so.
And you said that these are at all of the clinics?
Yes.
And they go on year round?
Yes.
Awesome. And where can people go to learn more?
Yeah. So they can talk to their doctor. If they're interested in getting connected to a doctor, they can call 312-864-0200.
Thanks.
Yeah.
Well, that are all the questions that I have today. Thank you for everyone who tuned in. We are on the second Tuesday of every month. If you would like to turn on the show, it's at 5 o'clock. Thank you both for coming today, and hopefully everybody has a great evening.